Okay.
And I'll say that about 150 more times, maybe just today. Hello, everybody. Welcome to the first week of ICD-10-PCS, which, as you can see on your screen, stands for International Classification of Diseases 10th Revision Procedure Coding System. And this is why if you ever write something and you just refer to it as ICD-10, I will tell you no, because ICD-10 is a code set used only by the World Health Organization. ICD-10-CM, your diagnosis codes that we use here in the United States, and ICD-10-PCS are used only in the United States. And this is procedure codes, ICD-10-PCS, procedure codes used to report what a hospital provides to an inpatient, not the ambulatory care center, not the outpatient. No. The patient's got to have a bed and a room on a floor. Okay. And this is going to parallel CPT, which current procedural terminology, which will still be used to report for the physician. What the physician does will be reported in ICD-10, I'm sorry, in CPT. Okay, so let me just set the mood here for you. All right, we're in a hospital operating room. There's a patient lying on clean sheets, hopefully on the surgical table, right? There are nurses and surge techs there. There, of course, is the surgeon, physician. Hopefully, there is an anesthesiologist. Okay. And of course, there's the room with all the equipment and yada, yada, yada. Okay. So CPT is going to report exactly what the surgeon does for this patient. CPT is going to report what the anesthesiologist does for this patient. But we have to report for the hospital because the hospital is paying all those surge techs and nurses. The hospital is paying for all the equipment, the electricity in the room, as well as those clean sheets. Okay. So we use ICD-10-PCS to report the procedure or service that was being provided in the hospital to an inpatient, to get them paid. And it is parallel to the CPT codes in the fact that the insurers, the researchers, the statisticians, everybody knows there is a standard of care. So if you tell me what the procedure was, I already know who was in that operating room, what equipment you had to use. Do you see what I'm saying? This is why this has to be accurate as well, to reimburse the hospital for their part in whatever procedure it was. Okay, does that make sense? Okay, good. I love it when things make sense. So keep going. All right, so getting started in this course. This course is a mini semester, which means it's only 8 weeks long. All right, that puts us around the middle of October. Between now and then, you only have 2 absences permitted. And an absence means you did absolutely nothing in the course. You did not submit any graded work. Now, you don't want to do that. Remember, this is an online course. You have 24 hours a day, 7 days in that week to get whatever it is done, so you can get your grade, more importantly, so you can get your learning and, of course, your coding practice. Okay? All right. Homework testing in the 8 weeks. You get 1 reopen. So that means you're going to get 1 time, oh, I forgot to do that assignment. Oh, I forgot to take that test. I don't like any of those excuses, but I'm forced to give you 1 redo, 1 gimme, okay? But let's remember, you are preparing for a job as a healthcare professional. Just because you're not a clinician does not mean you're not a healthcare professional. And you will be expected to behave like a healthcare professional, which means you have to be reliable, you have to be accurate, you have to show up. Okay, your deadlines each and every week. Each week's work is due by the end of Monday of that week, 11:59. So it's like the week before, ending on Monday instead of Sunday night. I don't know why it doesn't end on Sunday night, but it doesn't. It gives you until Monday. This does not mean you have to wait until Monday at 11:50 to do your assignments. Remember, when you're up against the deadline, you're feeling rushed, you're not likely to do your best work. Plan your work out. You have 7 entire days to do the work. Plan it into your schedule, okay? And don't crunch up against that deadline. But 11:59 p.m. Monday, that's it. And I don't like late submissions. So if you start giving me the, oh, my dog ate my homework, which actually when I was teaching on ground, it was about 15 years ago, I actually had a student not only tell me her dog ate her homework, but she brought it in and showed me his teeth marks in the paper. I laughed so hard, I gave her an extension. We are online. You would have to excuse me for a second. This is our chair on the phone, forgetting that we're doing our live session right now. Hello, Ms. Johnson. Do you want to? Good afternoon, Dr. Would you like to say something to my HIM225 class? Christina?
No, hello.
I'll call you when we're done. Bye. She's just checking up on me. That's okay. I like that. All right. So, deadlines. If you tend to be a procrastinator, if you tend to push things to right up to that door, then what I'm going to say to you is now, while you're in school, is the best time to change that habit. Okay. I will tell you that in all my years working in healthcare along with all kinds of facilities, hospitals, as well as 2 physician offices and physician groups, that the number 1 reason for getting fired is being unreliable. Not showing up late, leaving early. Know that 1 hour lunch turns into 2 hours, whatever. And that's not who you want to be, not go through all of this. Okay. All right. Online, Chrome should give you the best access. Today it was acting up, I will tell you, but for the most part, Chrome is going to be your best avenue for getting into the class. And just to remind you, 74.5% is passing in this class. And that also aligns with the national certification exam. Well, one of them is 75 to pass. The other one is 70 to pass. But the point is that that's it. And I don't want you to be skating that line either. Okay. Is if you are struggling, stop and email me. We can email back and forth. We can do a one-on-one Zoom. We can talk on the phone. Whatever it is you need. Frustration and struggling does not create an environment for really learning. And you're here to obtain knowledge so you can be not only an effective healthcare medical coding professional, but successful. And that's what it's all about. It's not about this course as much as it is giving you the tools you need for when you get out there after graduation. Okay. All right. Questions? No. All right. So, as you may have guessed, and those of you who are here, you have figured out that the Zoom, I did put up an announcement, but these are the rules, is no announcements anymore. You have to come into the Zoom, but here's what I want you to put on your calendar every week, every Wednesday at 1 o'clock. I will be here yammering about something you need to know. Okay, I like to call it sharing knowledge, not yammering. Some people might call it yammering. Whatever, I'm here to help you. This is your chance. If you know, some people say they don't like online because there's no one-on-one, there's no interpersonal, but this gives us that interpersonal. And I'm also available to you in 50 other ways. Okay. So we got you covered, but we don't know what's going on in your head. So every Wednesday, 1 o'clock, be here, but it will be recorded like we are recording this. And so the recording will be there, whether you want to listen to something again, or if you cannot, for whatever reason, attend the live session. Okay. All right. So this is very, 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 very important. Did you see that emphasis that I gave that on importancy? I know that's not a word. Okay. That's why they don't let me teach English. All right. I want you are a student online, and whether this is the 100th class you've ever taken online, or whether this is the very first class you've ever taken online, you need to create a contingency plan. What happens if you lose power or internet service? It happens. Connect with family, friends, neighbors, where you might be able to take your laptop and go use their internet access. The local public library has computers that you can use. And if you have a laptop, you can take your laptop and go to McDonald's, Wendy's, Panera Bread. There are 1,000 places that offer free Wi-Fi. You can even go sit on a bench in a shopping mall where it's air conditioned. I don't know, I'm in Florida, but you know, if it's hot. Anyway, the point is that I don't want you to think about, oh my gosh, it's 10 a.m. on Monday. I didn't do my work and my internet service is out. You should already know what you're going to do, how you're going to handle it. Also, what happens if your computer dies, which happens, you know, it's very sad. But, and they also typically don't give you notice, you know, it's just, all right. So again, family, friends, neighbors that might let you use their computer or their laptop. Aaron Rent-A-Center and all of these furniture rental places, they advertise a lot. They also now rent laptops by the week. So if you need an emergency laptop, and if you live within area around or near Sumter or can get to Sumter, you can always use the CCTC computer lab. Okay. So all of this is important, and proper ways for professionals to behave is to have a contingency plan. And as you go through your career, you may decide you want to get into healthcare administration, which is also good. And the hospital and the doctor's office are going to have emergency contingency plans. So this is excellent experience for you. It also shows you are a responsible adult. Please don't be insulted if I'm calling you an adult. Thank you. Okay. All right, now on to the meat of the course. All right, as I said before, ICD-10-PCS stands for Procedure Coding System. This is the code set used to identify services, treatments, procedures performed by the hospital to an inpatient. Okay, not the surgeon, not the attending physician, not the consultant, nobody else, the hospital, what the hospital is providing. Okay, and different from ICD-10-CM, all ICD-10-PCS codes have 7 characters. 7, always 7, never 6, never 8, no dashes, no moderators, no modifiers, no dots, just 7 alphanumeric characters in a row. Alphanumeric, of course, means that you will have a combination of letters and numbers in your code. Okay. All letters of the alphabet are used except for the letters O, so it doesn't get confused with a 0, and the letter I, so it doesn't get confused with the number 1, which I think is great, and I think everybody should do that, especially if you remember, maybe when you were doing your ICD-10-CM, and you were doing pregnancy codes, and the fact that the pregnancy code starts with the letter O for obstetrics, and sometimes you may think it's a 0, or you may make a mistake in typing. Okay, so this, very smart, no letter O, no letter I, only 0 and 1, and all the other alphabet letters. Okay, the American alphabet, by the way, just to confirm that. All right, your ICD-10-PCS book. I have not received my 2023 book yet, which, will go into effect on October 1st, but I was told it's on its way. All right, but this is your PCS book. It has 3 sections, all of which are very, very beneficial to you. The alphabetic index. Unlike ICD-10-CM, you are not required to go into the index. If you already know which table you're going to be working from, you can go right to it. But the alphabet index can be very handy, especially in these beginning times when you're trying to get your brain to kind of separate and reinterpret a term that's used in CPT that is not used in PCS. For example, biopsy. Biopsy is used in CPT to identify when a surgeon goes in and takes a piece of tissue or a part of an organ so that they can do lab tests, okay? But in PCS, that's known as an excision, when you only take part of an organ. If you take the whole organ, it's called a resection. See, but still in CPT, it's still called an excision. So this is all part of how the index may be able to help you, is because it will list the CPT terms and point you toward the PCS term, okay? Then you have your tables, which give you the rows and columns so you can build your code according to the documentation. Excuse me. Once you get to the 4th character, which is the body part, and you pick a row, you got to stay in that row. You cannot go jiggy jaggy, okay? You got to stay in that row across. And if you get to a point where one of the items does not fit, then you got to go pick another row, okay? Which is often, okay. Now, the appendices in the back of the book are also incredibly valuable, because they will give you examples and definitions and and better connections on how to use the terms for the approaches and the body parts and things and the root operation term. And so definitely you'll see I have mine tabbed. Okay, definitely tab that and use that. And remember, when you do your national certification exam, the book comes with you. Okay, so that's very, very important, especially and helpful if you have to answer the anatomy and physiology questions that'll be on the exam. Okay, all right. So the good news is this one code book gives you everything you need to do this and do this correctly, accurately, alongside with the operative notes or the procedure notes or whatever it might be. Okay, remember, no E&M because we're not doing physicians, we're doing hospital. Okay, all right. All right, so the index primarily is sorted by root operation term. For example, bypass, excision, insertion, and you of course will get that from reading the procedure notes or the operative notes. But they do have alternatives. There are some things that are identified by body part, not mostly. Remember, the procedure is all about the root operation term. What specifically was done to or for the patient? We did a bypass. We did an assertion. We realigned the broken bone, whatever it might be, that's the focus. And then you will put in the other details around that. Does that make sense? Good. All right. All right. Body system is the entire system, not an individual anatomical site. So if the procedure was a bypass of the heart, of one of the coronary arteries, okay? If there was a bypass for a coronary artery, the body system would be the cardiovascular system. Okay. Okay. If the large intestine is being treated, then the body system is the digestive system. Okay, you learned this in anatomy and physiology. You may have forgotten it, but pull out that anatomy and physiology textbook and review it, because you got to know. Okay. All right. Anatomical site. Now this is when we get to the fourth character of the PCS. Now it's asking you for a body part. So now we're going from the entire system to a very specific location within the body. So your fourth character is going to identify, oh, digestive system. Now, which body part? Remember, the digestive system starts at your mouth, goes all the way through the body, the alimentary canal, out the anus. So you got to clue us in. What part of the digestive system is being cared for today? Okay. All right. There are common terms such as hysterectomy that you'll also find in the index. But if you remember from your medical terminology, hyster is uterus, ectomy is the surgical removal of. Now in CPT, hysterectomy might be considered an excision. However, in PCS, if you're removing the entire organ, it's not an excision, it's a revision. I'm sorry, a resection. Okay. Again, you don't have to worry too much about this because the definitions are right there in the book. They're in the front of the book, they're in the back of the book, and they're also on every table. So you have to do something that your kindergarten or your first grade teacher told you to do or taught you to do. Read. Read. Don't get all caught up in, if I'm going to be a professional, I have to know this. It has to be in my head. No, too much information. Let it gently get into your head. I want you now to rely on your written word because that doesn't make mistakes. Okay. All right. The table section is in numerical order. So we start with 0, go through 9, and then that's followed by letters B as in boy through J as in
Juliet.
Okay, thank you. All right,
Retired
very
military.
good.
I knew all those.
That's excellent. So that helps. And so you might say what I thought you said, all the letters and all the numbers. And yes, but one thing about PCS, which is important in healthcare, is it's got to have room to grow. Because we're always coming up with new things happening in healthcare. It's out. I am constantly amazed at the new and exciting treatments and procedures. And wow, it just is amazing. I don't know what other word to use. So that's why it's not going all the way to Z yet, but the codes themselves will incorporate more of the letters. This is just going to be the first. Okay. All right. So the table section, for example, looks exactly like what? A table, right? Okay, you see we got rows, we got columns. All right. So as you go through, you build your code. You know that this is going to be a procedure, a medical or surgical procedure. As we go through, you will learn about the other sections, okay? The med-surg section in PCS is the largest section in PCS because, I mean, think about it. What do hospitals do? Medical care and surgical care, and that's that. Okay, then we have that identifier, that letter or number that's going to identify which body system. Then the third character is always, and these are always, okay, always the first character is going to identify which section of the PCS book. The second character, for the most part, it changes when we get to imaging or other stuff. But anyway, for now, the body system, the third character, the root operation term. And you will notice that you not only have the character here, but the book gives you the definition. So you don't have to remember, oh, in this section, D as in dog is extraction, which is pulling or stripping out or off all or a portion of a body part by the use of force. So extraction, like pulling out a tooth. Okay. All right. The fourth, fifth, sixth, seventh characters are then provided to you in columns, okay? And as I said before, once you pick a body part, you got to stay on that row. You cannot go up and down and up and down. You got to stay across. But as you look at the body parts here, you will see, again, a character with its definition. And you see that there's a long list here. So it gets very specific, which is a good thing. That's what we need for research. That's what we need for documentation. The next character, the fifth character, is going to explain the approach, which is how did the doctor get from outside the body to the organ or location in the body upon which the procedure is being performed. Okay. And then the sixth character is going to be a device. Now, most of the time there's no device, but there might be. For example, if we go back to a problem in a coronary artery, the physician may put a stent in. Stent is a device. So you're going to report, because there's not just one stent. There's like 10 different kinds of stents. So you got to identify what kind of stent, and then that will be in the sixth character. And then the qualifier is kind of like a miscellaneous. Okay, they're going to throw all different kinds of stuff in there, depending upon what the rest of the code is expressing. So in this particular case, we are talking about extracting something from a body part. And evidently, the only reason to do that is for diagnostic testing. So you'll see, as a qualifier, you can identify that this was a diagnostic test. In other cases, you might see a choice between diagnostic and therapeutic. We're doing this to confirm a diagnosis, or are you doing this to fix the problem? Which is why we taught you that, remember, in anatomy and physiology, medical terminology. Yeah. Keep your medical dictionary handy as well. Okay. All right. But remember, you're going to start in the PCS book because it's got what it means. Okay. So look at this. 7 characters. Each character identifies something specific. You build each code from the tables, and this 7-character alphanumeric mishmash actually means something specific, very specific. Okay, and that's our job, is to interpret what the physician wrote in the medical terminology, in the procedure notes or the documentation, and interpret it into a code that, one, protects the patient's privacy. Because if I tell you this patient got a 0996000Z, you don't know what that is. I assume. Okay. And there's another very, very, very important aspect to using these codes, and this goes for ICD-10-CM, CPT, HCPCS Level 2, as well as PCS, which is, this is something a computer can easily understand. So now we can have computers analyzing 100,000 patient records and determine how many patients in a particular area are having this particular procedure. Okay, very important for the future, as well as reimbursement. Oh yeah, there's reimbursement. Okay, all right. So the structure, as we just went through, but I just wanted to reinforce it a little bit. The first character of the code always identifies this section of the book. So you know that if it starts with a 0, that's medical surgical section. If it starts with a number 1, it's obstetrics. If it starts with the letter B as in boy, it's imaging. Okay, etc., etc. In the front of your book, you have the whole list. Okay. Each section of the list shows a grid which specifies the meaning of each character in the code. That's what we just looked at in the tables. Okay. All right. So you can see here that what I mean by that is, at the beginning of each section, the meanings of the character in a particular location within the code will change, because the overall thing that we're describing is going to change. Okay, so what? Allow me to give you an example. Okay, in the medical surgical center section, The first character identifies the section of the PCS book. The second character identifies the body system. The third character identifies the root operation term. The fourth character identifies the body part specifically. The fifth character identifies the approach. How did the doctor get there? The sixth character identifies any devices that may have been placed into this patient that will remain after the procedure is over. And the seventh character is the qualifier mishmash. Okay? Pretty straightforward. However, when we get to the measurement and monitoring section, you will note there is a difference. The first character identifies the section of the PCS book. The second character, the physiological system. The third character, the root operation system. That's pretty much the same. But the fourth character now is the body system, not body part. The fifth character is still the approach. The sixth character is maybe a device placed into the patient, or it could be a function. And we have the qualifier bringing up the rear. But in the imaging section, the first character is going to be the section of the PCS book. The second section, the body system. The third section, the root type. Okay, pretty much the same as med surg, right? For body part, med surg. But now the fifth character is not the approach, it's contrast. Because in imaging, you know, sometimes you put contrast, sometimes you don't. And by the way, you need to know what the contrast was. This is not like CPT, where you just have with contrast, without contrast, or with and without contrast. You got to know exactly which chemical was used in this contrast. But that should be in the documentation. And here you have two qualifiers. So, oh my gosh, how am I going to remember all of this? Oh, wait, you don't have to remember any of it. You just have to remember to read because it's all written in the PCS book. Okay. Now, because this is a code set, as I mentioned before, that is designed to have room to grow, there will be times when you're coding a procedure where a particular thing, like we saw with a device, right, is not applicable. So instead of N/A, we put the letter Z as in zebra.
I have a question. So, but that Z has to be a choice in the table also. We can't just say, oh, none of our choices are right, so it must be a Z, correct? It has to be in the table.
Exactly. So, but that brings up a good point, is if you're going through the table and none of the choices fit what you're doing or what it says, you either have to go to a different row, a different table, or you have to query the physician.
Okay.
Okay. And that's one thing that I love about PCS is you can't just make something up. You can't put that square peg in that round hole. You have to find what is accurate according to the documentation. And it's there. And if it's not in the documentation that matches the book, and you can't find anything else that's better in the book, you have to query the physician to get some clarification or additional detail. Okay. Yes, that was an excellent question. You cannot just say, nah, I don't like any of these choices, I'll put a Z. The Z has to be available to you on the table, which again, you know, like I said, is I like that. It's easier when you have options, and the options are, you know, not like CPT, your options for each part of the code are actually cut up in little hors d'oeuvre size. You know, this is appetizer, little pieces. So it's easy to identify when one thing doesn't fit. Excellent. Any other questions? Okay, if you don't have them now, you might have them later. And so I'm here for you. I'm here for you 7 days a week. I am in the course, and check the email, 7 days a week. So whenever you have a question, Pop it in an email. I promise to reply to you within 24 hours. Also, I think there might be something wrong with one of my CCTC email addresses. I'm not sure, but if you do not get a response from me within 24 hours, then put something in the discussion board within the class. You know, it'll say, ask me a question, or how can I help you, or something in the discussion. Just post something there, and then I will respond to that. Okay.
I did notice none of my grades, I've paired connect with CCTC and everything. None of my grades have transferred over or anything. So I don't know if there's something going on with that. Normally it transfers as soon as I finish them, but it had nothing
Okay.
has. So I don't
All
know
right.
if there's
Let me say this. All right. If by Monday they haven't connected yet, they haven't fed through, send me an email or put something in the discussion. And you know, and then I will check into it. Because this is the first week,
yeah.
and there have been issues with my CCT and like that.
Okay.
So, okay, but I will absolutely not let you not get credit for doing your
Okay.
work. And again, at least I'm aware that that is very bad English, but Ms. Johnson won't let me teach English, which is fine. Okay. Anything else I can help you with?
Nope.
All righty then. Have a wonderful day. We're going to have an absolutely wonderful course. I love this code set. It is absolutely my favorite. So I will get you to love it too. Okay.
All right. Take
All
care.
right. You too.
Bye-bye.
Bye.